Okay.
Okay. Welcome back. I'm Terrence Baker from NABN TV. I have the honor to be here today with Karen Kotsky, who's...
Sharon Kotsky. Sorry. You said Karen. So let's do
Oh!
that over.
Yes.
Okay. Go ahead.
From Sharon Kotsky. Moses was giving me this lion thing. And, yes. Sharon Kotsky from Boise, Idaho, who comes to us today as the CEO and president of Photonic Healing. So, welcome back.
Thank you.
Sharon, we were talking a little bit about how light works. And a lot of our guests today, a lot of the viewers may not be familiar with how light has the unique ability to be absorbed through something called chromophores, which are basically photoreceptors that absorb specific wavelengths of light. That light is then absorbed into the cell and transported to something called the mitochondria. Now, the mitochondria are sort of like the energy warehouses for the cell. They create the energy known as ATP that then allows the cell to reproduce and heal itself and perform all the cellular functions. But a lot of times a damaged cell has loss of mitochondria, has a loss of ATP, has a loss of ability to heal itself. And so what we're doing is we're providing an external source of energy that is transported directly, the electrons, the packets of energy from light, transported directly to the mitochondria for the purposes of healing the mitochondria so that the mitochondria can produce ADP and ATP, which then can be used to heal the cell and to turn the cell back on. So damaged cells have the ability to regenerate, rejuvenate, heal themselves, produce new cells, divide and replicate, produce new cells that will then heal. Because you remember that a lot of times when you have an injury, the blood supply to the cells that have been damaged has been reduced. You also have swelling to the area of injury, and swelling also reduces blood supply to the area. And you'll recall somewhere as a child you heard, life is in the blood. Well, the life of the cell is in the blood, and the ability of the blood to get to the cell and carry all the nutrients, all the nutritions, all the vitamins and minerals and oxygen and all the things the cells need to grow and reproduce. But if you've been damaged, then the blood supply can't reach the cells, and the swelling will prevent the blood supply from reaching the cells. And so the cells become damaged, or they go into what I call dormant. They become dormant. They're not dead, they're not alive, they're just surviving.
Okay.
But they can't heal. By providing an external source of light, you're able to directly provide the energy necessary to heal the damage and to restore life to the cell, turn the cell back on. And when it does that, you can not only heal the cell, but you can also restore the swelling fluid called lymphatic fluid back to normal by healing the drains that drain the extracellular fluid, known as lymphatic fluid. You can heal those drains, and you can also even grow small blood vessels known as angiogenesis. You can grow new blood vessels to improve the blood supply to the area that's been damaged. So all these things are the result of applying light. Yes?
What is the role of nitric oxide in this process?
Nitrous oxide is an important chemical reaction that is part of the healing process. It's not the sole process, but it is a component, a necessary component for healing. It turns out that the application of light to cells, in part, stimulates the production of increased nitric oxide, known as NO, or nitric oxide, which is a part of the chemical reactions necessary to decrease inflammation and to restore cellular life.
Great. So that kind of just leads into the segue of dosing. You know, dosing is kind of an area and a term that, as a manufacturer, we're very interested in giving you correct information to be able to determine the dosing, What is your opinion about low and slow delivery of light versus strong and high intensity and fast?
I believe that cells respond better and heal better when low doses are provided over longer periods of time. I believe that it's true you can provide with the Vism and other instruments of light, you can provide 1 or 2 joules of energy in literally in seconds. Or you can provide 1 or 2 joules of energy over 10 minutes or longer. Which is better? It's my professional opinion, based upon using medical therapeutic lights in my own practice now for nearly 20 years, that low doses of energy applied over time have a better result than cells that are treated with short bursts in light energy over short periods of time. That's just been my observation over these many years. And I think the reason that I use is I want you to imagine a cell that's been damaged receiving a burst of light in seconds versus a cell that's bathed in light for 10 minutes.
Right.
Same dose of energy, 1 or 2 joules of energy, a burst, an instantaneous burst administered at the snapping of my fingers, versus bathing for the next 10 minutes that light in the same dose of energy. And it's just my experience that cells have more opportunity to absorb that energy and to use it constructively to regenerate themselves when they are provided that dose. Now, the nice thing about the Vism is that if there are practitioners that don't agree with my opinion, the nice thing about this device, the Vism, is that they can supply the dose in a short period of time, seconds,
Right.
or if they happen to agree with me, or they're somewhere in between. They can provide the dose instantly, or they can provide it over 10 or 20 minutes, because this device allows them to do either one. As far as I know, it's one of the few devices on the market that offers that type of flexibility in terms of dosing. But that's my thought about it, and I've considered this issue, at length. Like, for example, we're treating patients who come in with gangrene on the ankle and foot. We're bathing for over a 40-minute period. We're bathing that ankle and foot in light for about 40 minutes, about 20 joules. So 20 joules per centimeter squared over 40 minutes. I can supply that 20 joules in a minute or two. But we choose to administer it over at least 20 minutes and many times 40 minutes, 3 times a week. We're bathing that ankle and foot in pure, unadulterated energy, light energy, that the cells can then use to recover from stasis, recover from damage, and begin the process of regenerating the damaged skin of the ankle and the foot.
Well, so do you happen to have like a sweet spot of joules that you like to deliver?
Yes, I do. I find that when you're talking about small joints like fingertips, digits, toes, thumbs, that I like 1 or 2 joules per centimeter square as a starting dose. And then what I do is, based upon clinical reaction, that is improvement of the condition, I will either increase the dose or decrease the dose based upon the patient's response. For larger joints like hips, knees, ankles, feet, elbows, shoulders, necks, spine, I like 20 joules per centimeter square as a starting point, because those larger joints require a larger dose to bathe the entire knee, the entire ankle, the entire elbow, the entire shoulder, the entire spine. Takes, on average, about 20 joules per centimeter square. And I use that as a starting point. That's not an ending point, but that's a starting point. It's an average starting point. Some patients, like if I'm treating an NFL football player, like Ray Lewis from the Baltimore Ravens, I'm going to use a bigger dose. Why? Because there's much larger joints,
Right.
and a much larger spine, and much larger muscles. And so I'm going to, even if I start at 20 joules per centimeter squared as a test dose, I know that I'm going to need to increase. We have athletes that come to us for performance enhancement. That is, Charm City Bike Club has come to us for years to use our medical therapeutic lasers before a race, a bicycle race. What are we doing? We're enhancing their performance, their athletic performance, by applying medical therapeutic light to the muscles that get tired first when they're out there cycling. This technology was first seen by Mr. Armstrong, Lance Armstrong, who used medical therapeutic laser light, was one of the first cyclists, one of the first professional athletes in the world to use this light. But he was using a very low level, only 5 milliwatts of light. He was using a very low light instrument to recover after each of the legs of the Le Tour de France. And was obviously was successful in doing that. And so, so performance enhancement is another application of this light energy, which is very exciting. We're just starting to understand because it allows an athlete to train right up to the event, come in and be treated with medical therapeutic light, or have a unit at home where they treat themselves, that is, bathe those muscles, in light energy in preparation for restoring the cells to maximum capacity of ATP, making sure all the mitochondria are maximally energized so that when they go out to race the next day, they'll have the best chance of success.
So how many joules do you feel that somebody should get in a session? Not joules per centimeter squared, but total joules.
Well, it depends on the condition. Like, for example, if you're treating multiple joints, you might end up using 40, 60, 80 joules of energy or more if you're treating multiple joints. Like if you're treating both knees, both ankles, you potentially could be, using 80 joules or more of energy, and probably will be. On the other hand, if I'm talking about I've damaged my index finger, then you're probably talking 2 to 5 joules of energy is more than enough, and sometimes as little as 1 joule of energy will actually provide the energy necessary by the mitochondria in the cells to recover.
And I heard you mention the magic word in there, depends.
Yes.
Because so much does depend on that specific situation with that specific individual.
That's right.
How often would you suggest that somebody does their sessions? And I know that goes right back to the depends word as far as what their situation is. But if they were to come into the clinic for back pain,
Yes.
how often would you treat them?
In general, I treat patients 3 days per week. Start the patient off 3 times per week for sessions that are the shortest would be 10-minute sessions. The longest session would be 40-minute sessions. Again, depending on how much energy they needed and what joint we were treating, what medical condition we were treating. But most of my patients come to visit me 3 days a week for 10 to 40 minutes. That's the first 2 weeks. And we're reassessing the patient every 3 days for what I call plateauing. That is, patients receiving the maximum benefit. They don't feel like they've had any subsequent improvement, and so we're looking at changing the dose or changing the parameter. After the first 2 weeks, I often will go to twice a week, again, with reassessment every second or third session to make sure that the patient is continuing to improve and that there's no further adjustment to the prescription. Because you recall what we're doing is we're providing a prescription of energy, just like we give penicillin for a sore throat, a strep throat. We give penicillin 500 milligrams 4 times a day for 5 to 7 days. What are we doing with a light prescription? Well, we're applying red or near infrared light or any of these wavelengths We're applying it 3 days a week. We're applying it for 10 to 40 minutes, depending on the prescription. And we're recessing the patient every 3 days to see if adjustment to the prescription needs to occur.
So is it possible for someone to get too much?
Yes, it is. We frequently have athletes and men and women who are working full-time who have suffered an injury, and they just can't afford to be out of work. So some of these individuals will really want to receive the maximum dose per session of light that they can receive.
Because more is better, right?
Exactly. In America, we believe that a bigger hammer, if a small hammer's not working, we get a bigger hammer. Yeah, if a small prescription of penicillin is not working, then we get a bigger prescription of penicillin, and so on. So yes, we have this great American belief that more is often better. But that's not true with light. And the reason being is that the cells appear to have a maximum capacity for absorbing the light, and excessive light either does nothing, it's just a waste of time and money, or it can actually cause more excitation and more inflammation and actually make the patient transiently, temporarily worse.
Okay.
Yes, and they'll have more pain and more swelling and more inflammation for some period of time. Now, the good news is that they will recover from that excessive dosing. And usually when they recover, they will then begin to show improvement. But for a while, it can actually make patients considerably worse. And we call that the ARNTS curve. That is the optimal dose of energy necessary to heal the cell and not cause excessive excitement or excessive inflammation.
And how do you know when you're there? How do you know that?
Well, I think what you do is you stay within accepted parameters. That is, you start off low with your dosing, 1 or 2 joules per centimeter square, and you advance as the patient reports that the improvement that they're receiving has stopped. And so then you'll increase that dose of energy. And you'll continue to increase the dose of energy on average every 3rd session, treatment session, until the patient is either healed, which is usually what comes first, or healed, or no further improvement is noticed. That is, you increase the dose, but no further improvement occurs.
Awesome. So now that you've been using the light in your clinic for a while, can you share with us some of the benefits that you have seen by using the light? Are you seeing more patients? Are you treating different conditions? Are you able to treat some things that maybe you hadn't treated before? I know you've got lots and lots of incredible lasers in there, but if you hadn't and you're a doctor that was looking at investing in this light, what would you tell them that they would be able to do that they might not be doing right now?
Well, number one is I believe that for acute and chronic pain, that medical therapeutic lasers and LEDs, such as the Vizim, provides an alternative source of treatment to narcotics like oxycodone and OxyContin. What it does is by providing an external source of energy to start healing the damage, often less pain medicines is required. And particularly if you start treating the patient early in the course of their illness. Like, let's say the sooner you treat a motor vehicle accident for the pain of the accident, the less likely they are to need OxyContin or oxycodone. Number two is that patients who are on oxycodone and tramadol and OxyContin can often reduce the amount of medication they need by supplementing their treatment with medical therapeutic laser light. And so one of the things you can do is you can use these medical therapeutic lasers like the Vizim. You can use it to reduce the amount of narcotics required, and you can take patients that are already on narcotics and you can begin to taper them down. For example, once you start treating the patient, then every 2 weeks you can begin to reduce the dose of the medication by 20%, and that patient can get down to the lowest dose possible, or stop altogether. And we've had many patients come to us to get off of oxycodone, and the DISM has assisted us to get those patients drug-free. And so that's, next is wounds. We have patients come to us with medical wounds, pressure sores, surgical wounds, traumatic wounds, diabetic wounds, poor circulation, vascular wounds, that just don't want to heal. And they're causing the patient a lot of anxiety, a lot of pain, a lot of discomfort, and a lot of money for all the dressings that they're using, and all the wound care doctor appointments that they're keeping. So one of the things we do is we use medical therapeutic laser light to heal wounds that other doctors don't believe can be healed. They can't be healed surgically, they can't be healed pharmaceutically with medications, but they can be closed and healed using medical therapeutic lasers like the VISM. So that's another example. And even patients can use the VISM at home, as we talked about, with the presetting for wound healing. Use the preset setting to treat that wound every day or every other day until it closes.
Is there any medications that you have found that, you brought up the narcotics, but is there any medications that you found that kind of interfere with the light?
Yes, I think physicians and practitioners, healthcare workers need to be careful about applying the light, an LED or laser light from the VISM or any other light source in patients that are on prednisone, steroids, anti-inflammatories like Motrin, naproxen. There seems to be something about these medications causing an interference with the mechanism that the light uses to heal the cell. That is, the prednisone and the non-steroidal anti-inflammatories like Motrin, they appear to send out a signal to the cell that we've got this under control. We got it covered, and we don't need you, and therefore the light's not being used to provide electrons and energy to the mitochondria, and therefore the mitochondria is not creating the ATP necessary to heal. So I think what they do is they sort of fake the cell out, non-steroidal anti-inflammatories, if you will. We live in a world of fake news. Well, this is cellular fake news, where the non-steroidals and the prednisone basically say, I got this covered. They don't, but that's the message they send out so that the pathway, the chemical pathways that use the electron packets of energies don't work as well or don't work at all.
In your office, who is administering this therapy then?
Well, all of us essentially. Starts with me, the physician, and then my nurse practitioners, then my RNs and LPNs, and I even have some patients who come in that are being treated by my nursing assistants with, if it's an LED application, are being treated by my nursing assistants for a prescription that I've written. So, and then again, some patients are going home with the device for maintenance, and so essentially all the staff and even the patient themselves can use this technology to improve their health and to recover from illness.
And so you found it really easy to use and easy to share with your patients?
Yes, and that's the nice thing about, there are medical conditions that require a laser light source. That is, like for example, if I'm going to remove a tattoo, then laser energy is required.
Right.
And an LED will not be successful. But on the other hand, today we're not talking about removing tattoos. We're talking about healing. Okay, we're not talking about destruction. We're talking about healing, regenerating, restoring health to the cell. And my lasers that remove tattoos, they are not restoring cellular health, so to speak. They're actually destroying cells full of ink so that the patient can have the tattoo successfully removed. So it's important for patients to understand that LEDs have added a safety measure to the treatment of medical conditions at home using medical therapeutic light devices. They've added a safety measure that lasers don't have. For example, even a laser pointer, as your grandmother told you, can shoot your eye out.
Right.
Yes. And so even a very low level laser light and laser pointer can cause significant harm. Whereas that same red light is actually being used to treat eye conditions if it's an LED.
So if someone looks at the light and they say, oh, it's not strong enough, what would you say about that?
Well, first off, what we know about cellular regeneration and cellular healing is that it appears to require very low levels of energy to the mitochondria to produce the ATP necessary to restore cellular health. The amount of energy necessary is low. And that's why I recommend you start low and go slow over a period of days and weeks to treat your patients. And for patients to understand that this is not a magical treatment. What do I mean? Cells in each of us, because of our genetics, that is the DNA that we inherited from our parents and their parents, that the cells in our body have a specific rate of being able to heal. They have a maximum rate that they are capable of healing when everything's just right. And whatever that time period is for a cell to heal itself, that's what it is. The application of light does not accelerate natural healing. You can't heal any faster than the maximum capacity that you have. But what the light does do is it does allow you to approach that maximum capacity of healing. You won't exceed it. You won't go faster. But it can allow you to approach that maximum level of healing. And that's our French colleague who came up with the frequencies. What he was saying is that by adding frequencies in harmony with light, that you can accelerate cellular healing and you can maximize cellular healing by using the two modalities together.
So if you were going to speak with one of your colleagues, doctor to doctor, what would you tell them about the light? How can they use this light to make their business prosper? How can they avoid all the junk that's out there? How do they tell the difference? And what advice could you give someone that was looking for adding this into their practice?
Well, the first thing that I would do is to study the science. For example, we have a conference October the 1st, 2nd, and 3rd coming up that's online by NALT, North American Photobiomodulation Organization, and WALT, the World Association of Light Therapy, where you're going to have world leaders talking about the application of light. Over 52 speakers will be teaching about the application of light to various medical conditions. So, number one, get some training, get some education. Number two is make sure that you correctly diagnose your patients, because light will only successfully treat patients when you have some confidence of what's causing their condition. And so you need to, number one, get trained. Number two, you need to be confident about what it is you're treating. And number three is you need to buy a piece of equipment. You need to buy your first piece of equipment, Lightavism, that can have the flexibility and can treat the medical conditions that you see in your practice. Yes, and the nice thing about the Vism is that regardless of whether you're a dentist, a chiropractor, an orthopedist, whether you're a brain surgeon, whether you're a heart surgeon, regardless if you're a general practitioner or a general chiropractor, or a general physician specializing in integrated medicine. This is a device that offers the flexibility and the durability and is portable that you can move around. Earlier today you saw some of the lasers we have in our office, and they are not very portable.
Not going in your purse on the plane, that's for
They're
sure.
not going on the purse in your plane. They're not going with you on a missions trip to Africa.
Right,
They're not going to do a house call.
right,
Okay,
right.
but the Vism, I can carry with me in my white coat, my black bag, anywhere. My little holster, anywhere, and immediately start treatment on caring patients, no matter what environment I'm in. The other day I'm in a medical conference. A lady comes up to me and she's burnt her index finger on a coffee pot in the hotel. So what do? We apply 1 minute of light to the burn. The next day she shows me the finger, and there's no sign of a burn, right? And so it's portable, it's flexible, it's durable. You can take it wherever you go, and essentially will meet your needs. I even actually have 2 of them, and if I need a larger surface area, treatment surface area, it's very easy to take 2 of these and put them side by side. Or if the patient's got 2 painful knees, but only has 20 minutes of time to treat them, I just treat the 2 knees simultaneously with 2 different devices, because they're affordable, they're practical, and again, they only weigh a couple pounds at most. So I can treat 2 elbows, 2 knees, 2 ankles, 2 different spots, And essentially, the question you asked earlier is really no limit. I can treat 3 or 4 locations if I had 3 or 4 devices. I could treat 3 or 4 locations simultaneously without any difficulty.
That's awesome. When you are treating them, what method do you use? Can we show some of this?
Yes, we can.
Okay. This is where we need.
Okay, let's see. Rolling. Camera rolling.
Welcome back. I'm Dr. Terrence Baker here in Baltimore, Maryland. We're going to take a moment to talk to you about some different techniques that physicians use around the world to treat patients using medical therapeutic lasers. So we're going to be just using red light now on a device known as the Vism from Photonic Healing to show you several techniques that are being successfully used. The first technique is painting the skin, but you're not touching the skin. So it's off the surface of the skin, and you're using a painting technique to go back and forth, just like you'd use a paintbrush in your home. And so this patient has an injury to his arm, and we're just bathing back and forth. We're just painting his forearm with light. And this is called the painting technique off the skin. Next, we can do the painting technique on the skin. We apply the LED light to the skin, and we're moving back and forth. You doing okay? Good. And we're just on the skin, gently on the skin, back and forth, and we're using the painting technique on the skin. And what we're doing is we're applying the light. Now, what's the advantage of on the skin is that you reduce what we call reflection. That is, you deliver more energy to the damaged tissue, to the damaged forearm when you're actually touching the skin than when you're not touching the skin, because you get rid of something called reflection. That is the light bouncing off the shiny skin back out into the back into the air. And so we reduce reflection by actually touching the skin. Now, next we have the marching technique. The marching technique is where you apply the light to the surface of the skin, and you're actually touching the skin, and you're leaving it in place for a period of time, usually seconds, and then you're moving it. You're overlapping about 20 or 30%, and you're marching. And so what you're doing is every 2 or 3 seconds, but it can be 5 seconds, it can be 10 seconds, it can be whatever the prescription calls for. But you're marching. In this case, I'm marching every 2 or 3 seconds up the patient's forearm and touching with the skin. Now, sometimes you'll have something like sunburn or a skin condition like eczema, and you'll be marching without touching the skin. And the same thing is true every 2 or 3 seconds. In this prescription, I'm moving and I'm overlapping 20 to 30%, moving 2 to 3 seconds, overlapping 20 to 30%, moving. And so that's marching off the skin, okay? And that's for patients that have a skin condition where touching the skin is just not possible because of pain, inflammation. Or sometimes if you're marching, you can actually cause further damage to the skin if the skin is sensitive and fragile, such as a wound, like an abrasion from a car accident, or a rash from sliding into second base, and you get a rash on the patient's hip. And so marching by touching the skin would be not only painful, but it could cause further damage. Okay, so far we've talked about marching, and we've talked about painting. Yes. So, next is we have circular. We have circular off the skin. And what you're doing is you're painting in a circular motion, massaging, if you will. You're painting and massaging, and you're moving up the arm. You're overlapping 20 to 30%. You started at the wrist. We're moving to the elbow. And this is a circular massaging technique. Next is you can use circular massaging technique touching the skin, okay? And we're actually touching the skin and we're massaging the light into the skin by overlapping 20 to 30%. You okay? Doing okay? Great. So we're moving down, overlapping 20 to 30%. We're massaging, gentle pressure. Don't need to push deeply. Just gentle pressure, staying in touch with the patient, making sure you're asking the patient, are you comfortable? Doing okay? Good. You always stay in touch with your patient. And so what we call the circular massaging technique. Very effective for wounds that are healing and also musculoskeletal injuries such as forearm damage.
Is there any time you would actually put pressure on the light on the skin?
Yes. By applying pressure, you're actually deepening how far into, particularly with near infrared light. So if we put on the near infrared and we want to go all the way down to the bone, for example, to try to heal a bone that's been fractured, then what we want to do is we want to apply pressure into the injured area for the purposes of deepening the penetration of the light. Let's say a bone has been fractured and you want to heal it, or let's say the patient has a deep bruise, what we call a hematoma, and you want to get all the way to the bottom of the hematoma, or the patient has a wound that's not healing, like a decubitus ulcer, a venous ulcer, a stasis ulcer that's not healing, you may want to apply some pressure. Also realize that if you have a wound and you're concerned about contaminating your device, you can put your device in a sandwich bag. You can put a single layer of, I've sometimes even used a glove if I don't have anything else. Use a medical glove, a clear medical glove. You can also apply the light that way. You can use some sandwich type material. You can use a baggie. You can buy a cover for it. So you can also, in wounds that are wet or moist. Also the nice thing about this device is it's readily cleanable with alcohol. Alcohol pads or just alcohol, isopropyl alcohol that you buy over the counter, cotton balls or gauze. This device is readily cleanable.
So let's just do an example. Say he has carpal tunnel. What would you do? What would your approach be to treating that?
Well, I would see him, first off, we would write a prescription. We're going to apply in this young man. We would start off with 2 joules applied over about 10 minutes, and we would treat both sides of his wrist. So we would be doing 2 joules on what we call the dorsal surface, the back side, and then we would do 2 minutes on the ventral side. We would try to see him 3 days a week to apply these 10-minute treatments. If that wasn't possible, we could possibly send him home with a device and with a preset, or we could start out with 2 treatments if that's all that's possible, just understanding that it will take a little longer to get the result that we want.
So you feel, and with your experience in the clinic, that you can save a lot of people from having to go into surgery with your
Yes.
protocols?
We have a very high percent response rate, probably 85–90% success rate, avoiding surgery in conditions like carpal tunnel syndrome by applying medical therapeutic laser light. Because what are we doing? We're decreasing inflammation. What is the #1 cause of carpal tunnel symptom? It's pinching of the nerve due to swelling. Patients gain some weight, they have some edema, they're a keyboarder, they type a lot, they hammer a lot as a carpenter, they're a plumber, they're wrenching a lot.
Any
Repetitive action of the wrist, day in and day out. Or something new, like every year about this time, we see a lot of golfers come in with not only elbow injuries, but also wrist injuries. Why? Because they've lost their swing,
Right.
they haven't swung in months,
Right.
and they're not only hurting their shoulders, their elbows, their wrists, their hips, their ankles, their Achilles, or plantar fasciitis. You know why plantar fasciitis? Because they put on those daggone golf shoes that are like so hard, the soles, and the cleats are just so rigid, and they're not used to wearing shoes that have rigid soles. So they stretch the fascia, which is the arch of the foot, and they get a plantar fasciitis, can't walk, they wake up in the morning, can't even get out of bed because the pain is so bad, and it all comes from wearing golf shoes on the weekend that they're not used
Wow.
to wearing. Very common. We see it here in Baltimore, we see it year-round.
Wow. So I so appreciate you taking your time to help us. Is there anything that you feel we should still talk about that we haven't touched on?
Well, I think the important thing to know is that medical therapeutic lasers have been a science since 1907, when Filsner, Dr. Filsner opened his clinic and started using light to heal medical conditions. And so here we are now, 100 years later, and we know that it works. We know that for the last 50 years, we've been able to create LED devices that can be convenient, affordable, practical, and effective, and treating medical conditions that previously didn't have any good solutions, or the solutions required pain medications and other medications with significant side effects, or required surgical procedures to be performed in which there was no guarantee of success.
So if somebody is looking to add something like this into their practice, how do they know a good one from a bad one? And what would you give them as far as advice to sorting through all of the light therapy devices that are out there now?
Well, I think, number one is that they need to attend some training, like we're having with the upcoming conference, October the 1st, 2nd, and 3rd, with NALT, the North American Association of Photobiomodulation, and WALT, the World Association of Laser Therapists. But there are other training programs that are also available. For example, someone can go to your website and learn a tremendous amount of information about the use of light in the healing of conditions. So number one is they need to get some education about it. Number two is they need to decide what medical conditions in their practice do they think they could use light to heal. Like, for example, if someone wants to use light to remove tattoos, then this is not the device.
Right.
They need to purchase
Or
a
do
device.
surgery.
Or to do surgery.
Right.
Okay? Or to resurface your face.
Right.
Then
Non-invasive
this-
versus invasive.
Exactly. So first off, they have to decide what they're going to use light for. And then once they decide what they're going to use light for, then they need to start looking at leaders in the field that have a reputation for producing quality equipment that do what they're looking for.
Right.
For example, this device is flexible, it's durable, it's portable, it's affordable, it can be used for home use, but also in office use very practically. But it has its limitations. You want to treat pain, you want to treat wounds, you want to treat those type of medical conditions that anxiety, depression, headaches, migraine headaches. You want to treat soft tissue injuries. You want to treat arthritis. You want to treat rheumatoid and osteoarthritis. You want to treat sports injuries. You want to use it for enhancement of support of sports performance by using this device to treat the muscles that you're having problems with when you're performing. Like with the Baltimore Orioles, for example, we have them use a device like this to treat their pitching arm.
Sure.
Why? Because after the game, we want to immediately use medical therapeutic laser light to restore the ATP levels in the mitochondria of their pitching muscles.
And that might be their sore elbow, but we always say make sure you treat both sides of the body.
Yes, and I think the nice thing about light is you can treat both sides of the body, but also you have to understand that for reasons that we're still investigating, it's not unusual to treat the left elbow, the left golfer's elbow, but also get some benefit to the right elbow. Now, why is that? Well, because this device provides systemic effects.
Okay.
It provides systemic effects. Systemic means whole body effects, all the way from the hair on your head down to your toenails, are positively affected by the treatment of an injured body part. Now, how does that work? Well, what happens is the light energy gets into the blood, the life of the body, and travels to where it's needed, and then gets deposited, okay? In fact, there's one thing I call the systemic treatment, where I treat a patient's neck or treat their belly button with 10 minutes of 2 to 5 joules of energy per centimeter square for the purpose of what I call a whole body treatment. Like, for example, somebody comes to me with influenza, the flu, or a common summer cold, or even COVID-19, then, you know,
Because I want to talk about COVID.
what are we going to do? Well, we're going to do a whole body treatment by treating the base of the neck, okay? Treating the base of your neck. We'll call your cervical spine, starting at the base of your skull down to where your shoulders meet, okay? And we're just going to put the device on there, hold it in place, 10-minute treatment or preset treatment, or belly button, okay? Same thing, 10 minutes. These are two places.
On the skin, though, not through
On
the
the
clothes.
skin, right? Not through the clothes, never through the clothes, but on the skin, never through the hair. Always applied on the skin. Good point, because there are manufacturers out there who will talk about treating through clothing. Can't treat effectively through clothing, just to be clear. So you're going to treat the umbilicus around the belly button, or you're going to treat the back of the neck and get what we call a systemic treatment, which is a body-wide treatment where the energy will be taken to those organs and those parts of the body that need the energy in order to get well.
So, is that kind of how a panel would work then?
Well, panels are a bit mysterious because all panels are not created equal. And the reason being is that panels can be effective when applied in the manners that we've talked about. For example, there are some manufacturers that make wraps, and they make laser light applications that can be applied to the skin and an adequate treatment. But then there's other lights that you hang